Join you all today. I'm very happy to join you all in here. A little bit about me. My name's Kevin Hackshaw. I'm at the University of Texas at Austin, the Dell Medical School. I'm originally from Brooklyn, New York, and did my medical school at Baylor College of Medicine. Then I did my residency training at Columbia University back in New York, did my rheumatology at the University of Colorado. I have been previously at the Ohio State University in Columbus, Ohio for about 30 years. And I have been at Dell Medical School, the University of Texas at Austin for the last 2 years, heading up the Division of Rheumatology. So this is an important topic for you all and also for me because as we all know, as we get older, arthritis shows up at any point. And a very important topic, the importance of exercise for people with arthritis. So let me proceed. This is the take-home point. The most important aspect or approach to treatment of arthritis is, in fact, exercise. And exercise has to be tailored to an individual's personal situation. So let's talk about the big arthritic conditions that we deal with, all of us deal with. Osteoarthritis, first of all, is a slowly progressive degenerative disease. The hand joints, the spine, and the weight-bearing joints of the upper and lower extremities are involved, and it's the leading cause of disability in the elderly population. It's generally thought of as a non-inflammatory arthritis. So the clinical signs are that you experience dull joint pain that worsens with activity. There's stiffness after prolonged immobility. We call that gelling. And then there's crepitus. And what is crepitus? That is just basically creaking of the joints. So just as you're moving the joints in a normal range of motion, you feel crunching sounds almost like a Rice Krispies type of a sound, and that's called crepitus. What's happening there is that because as we get older, there is less fluid in the joints that surround each of our joints, you are now experiencing the cartilage rubbing against the adjacent cartilage. And in the worst scenarios, of course, you could have the bone actually rubbing against the bone. There is generally an absence of morning stiffness. What do we mean by that? So when you wake up in the morning, if someone has an inflammatory arthritis, such as, for example, rheumatoid arthritis, typically patients will experience 1 to maybe even 2 hours of stiffness in the morning, and it takes that long for the joints to get moving. But with osteoarthritis, generally, there is an absence of that morning stiffness. So you have the crepitus, that's the creaking of the joints. You have bony enlargement, and you may have some mild swelling as well. So these are the common painful joints that, as we get older, are often experienced. The shoulders, the hips, the knees, and the hands. So let's talk about those joints and then the approach to exercise in those particular areas. First, let's talk about the shoulders. So the shoulders are stabilized by these muscles that are shown here. There are 4 main muscles involved in what we call the rotator cuff. And those muscles are involved in allowing you to elevate the arm, to rotate the arm, to reach across, to hold it at a stable level. So these 4 key muscles, and I'll just name them once, the supraspinatus, the infraspinatus, the deltoid, and the subscapularis. So those are the muscles that stabilize the joint, hold it in place, and allow you to do all the things that you need to do with regard to rotation of the shoulder. So what damages the rotator cuff? Well, first of all, let me tell you that rotator cuff disease is very common in the population. In fact, when you look at individuals over the age of 60, 85% of individuals will have some rotator cuff disease. Now, in the younger population, the common issues might be overuse. So if the arm is overhead, or if you're doing tennis, if you're a baseball pitcher, if you're a football quarterback, these are types of activities where you are constantly using your arm overhead. And the problem with what that problem entails is that the blood flow to the rotator cuff is actually dependent on gravity. So when your arm is overhead, you're actually decreasing blood flow to the rotator cuff. So you might recall when you might have been younger, in your teens or even earlier than that, oftentimes when you're sleeping, you'll sleep with your arms above the shoulders, kind of cup your arms underneath the pillow as your head's on top of the pillow. And that's a common thing. And I used to do that all the time. And it's only after I got older and started experiencing rotator cuff issues that going to a physical therapist, they pointed out to me that, well, one of the things I'm doing is actually cutting off blood flow to my rotator cuff muscles. And so that's one of the first things you can do is make sure that you're sleeping with your arms below your shoulder level. Kind of keeping them at their sides. So you almost have to retrain yourself as you get older because of this type of issue. So these are the common causes of rotator cuff. And there are 3 different stages. So the first stage is where the tendons that attach the rotator cuff, there is some bleeding into the tendons and they begin to swell. Now that occurs usually when you're less than 25 years of age, but you might not experience any pain at that time. But then later on, as you get into ages 25 to 40, you begin to develop some inflammation, some fibrosis of the bursa and the tendon structures that hold the shoulder in place. And finally, once you get above the age of 40, you begin to experience tears of the rotator cuff and also the bicipital tendon. And when those tears become symptomatic enough and large enough, then you experience chronic pain, night pain. So what we like to think of is that the first stages, the tendon hemorrhage, the tendinitis, the fibrosis, they're reversible with appropriate treatment. So we might instruct our patients to again, sleep with your arms down by your sides and not sleep with your hands above your head. That's one of the simple remedies that we try to do to alleviate this process. But once you get to the tears of the rotator cuff, then it becomes a situation where we might have to bring in our orthopedic colleagues depending upon the patient's occupation. So if the patient is an individual who needs to do overhead activities, again, something like a baseball pitcher, well, then there might need to be some repair, surgical repair. But on the other hand, if the individual is older and they have a profession where their arms don't need to be elevated to that degree, then it's typically more conservative treatment. So by and large, orthopedic surgeons are veering to be more conservative. because they recognize that rotator cuff surgery is not highly effective. Only 25% actually do better after the surgery. So instead, it is focused on exercise and physical therapy. So this just tells you that rotator cuff tears are frequent. By age 40, 33% of the population will see or have a rotator cuff tear. By age 50, 55%, by age 60, 65%, and by age 70, 85% of the population will have evidence by MRI or elsewhere of a rotator cuff tear. Now, most of them are asymptomatic. 30 to 50% of them are bilateral. When you have full thickness tears, which occurs in about 25% of individuals over the age of 60, if you ask that individual to hold their arm out at just level or parallel to the ground, the arm drops, and that is indicative of a full thickness tear. So individuals just can't hold the arm up because the full thickness of that rotator cuff and those muscles that I showed you, there is a tear through them, and that is what allows you to hold the arm up. And so you lose that ability. So this graphic shows you the types of motions that are controlled by the rotator cuff. Forward motion in the top graphic here. Forward motion is dictated by forward flexion, forward extension, raising your arm straight overhead. That's full forward flexion. Note this graphic here, where the arm is behind the individual. That is maximum internal rotation. And these are things that get lost, or these are the activities or functions that get lost as we develop or have rotator cuff disease. This is arm abducted 90 degrees from the side. And then these activities, this is called external rotation. And these are all, again, the rotator cuff muscles. So how do we tell if someone has a rotator cuff disease? Well, some of the things that we do are we test the strength. So here is where an individual has their arm right at their side, and then what we're asking the patient to do is to push the arm out, push it out. That's called external rotation. If they can't push out against your resistance, then, and particularly if doing that leads to pain in the shoulder girdle area, that is indicative of a rotator cuff tear or rotator cuff disease. Here are some other tests that can be done to test for the stability of the rotator cuff as the individual tries to hold the arm up and the physician is pushing down on the arm. And if that activity leads to pain in the shoulder area, that's what we call rotator cuff disease. So again, this is just demonstrating some of those tests where the individual is trying to push in, you're pushing out against them, and if there is pain elicited in the shoulder girdle, that is indicative of rotator cuff disease. Okay, and so we're going to get to the specifics of the exercise, but I want to show you some other aspects of osteoarthritis first. So we talked about the shoulder and how it can be diseased. What about the hands? This is a typical presentation of osteoarthritis of the hands. You have bony enlargement of these distal joints. We call them Heberden's nodes, and you can see the bony enlargement noted right here. Here's another classic presentation with bony enlargement of the distal joints and the proximal joints. When it's in the proximal joints here, we call them Bouchard's nodes. So the distal joints, Heberden's nodes, proximal joints, Bouchard's nodes. All classic signs of osteoarthritis of the hands. What about the hips? So here's the hip joint shown on an X-ray. And you notice that there is not much room between the hip joint itself and the pelvis. One of my old mentors used to say that there was limited tread on the tire. So there's less of cartilage. What happens in this setting as a result? Individuals don't have the ability to externally rotate the hip in or out. This is called osteoarthritis of the hips. And in an advanced state, you see that whereas you were able to discern a joint space on this side, you see no joint space on this side. This is totally bone on bone. And this would be an individual that would not be able to cross their legs or do things of that nature. So this is osteoarthritis of the hips, advanced. Knees similarly can have osteoarthritis. So what you're seeing here in the lateral compartment of the knee, or the outside portion of the knee, is there is evidence of some cartilage, and that's why you have the separation. But on the inner portion of the knee, you don't see that area of cartilage, so the cartilage is worn down. And why is it worn down on the inside portion of the knee? Usually this might be someone who might have had some issues of being overweight for a number of years. So you have loss of the joint space here, and this would be someone with knee osteoarthritis. So we've looked at pictures that show you the shoulder, the hands, the hips, and the knees. Here is another side view of knee osteoarthritis. So how do we treat this? Exercise is number one. Exercise improves joint pain and function. If exercise can be used in conjunction with some medicines like acetaminophen, Tylenol, basically. If you're using Tylenol, no more than 4 a day, but that would be a safe dosage. Topical anti-inflammatories are safer than oral anti-inflammatories. So there are a variety of rub-on anti-inflammatories. One in particular one is called diclofenac gel, and that you can rub on 3 or 4 times a day. Another medicine that helps with pain is called tramadol. And another one that helps with pain, particularly nerve pain, might be called duloxetine. All of these adjuncts that I'm talking about should be used after consulting with your physician to make sure that there are no contraindications to using any of these agents. And then I have listed several other adjuncts. I'll just talk about a couple. Glucosamine with chondroitin, typically used up to 1,500 milligrams per day of glucosamine, 1,200 milligrams per day, and it's all taken at the same time. That's an adjunct for osteoarthritis, no matter what joint. So in other words, if you have osteoarthritis of the shoulder, the hip, the knee, the hands, this may have some benefit. Turmeric is another adjunct, typically 500 milligrams per day. These are, both of these are things that are available over the counter, typically in the vitamins section, and that you can obtain as an adjunct. Again, just as with the pharmaceuticals, you would want to let your doctor know if you were reaching for some of these. So back to the exercise component. Um, Exercise for pain relief and joint protection is recommended. All patients with knee osteoarthritis should be counseled on exercise, irrespective of their age or other underlying problems. And there's really no strong evidence on the best prescription of exercise modalities and dosage. In other words, how intense does the exercise needs to be? How long does the exercise need to go for? How frequent is the exercise? We don't have evidence for that, but the bottom line is we want patients moving, and that is key. So exercise takes a variety of forms. It could be aquatic. It could be Tai Chi that helps with balance. Weight loss is always important. Trying to achieve a normal body mass index is one of the key goals that all of us should have, no matter what our age. And then how do we achieve that? Well, sometimes there might need to be a calorie-restricted diet coupled with physical activity. Calorie restriction, particularly in older adults. And as I said, those are the ways that we try to achieve it. And then I talked about the topical anti-inflammatories. Another one that I should mention is topical capsaicin. That is the ingredient in hot peppers, and you will feel burning on the skin when you use it. But what that does is it depletes the area of some of the pain compounds that signal to the brain that you're in pain. So it helps to blunt pain response in a particular area. If you are using that, you want to be careful about washing your hands so you don't rub the eyes, because the residue might cause burning in the eyes. So exercise does a lot of benefits. It helps to reduce the risks of dying prematurely. It reduces the risk of dying from heart disease, reduces the risk of stroke, reduces the risk of developing diabetes, reduces the risk of developing high blood pressure. And for those who do have blood pressure issues, it helps to lower that at that point. Other things that exercise does is that it reduces the risk of developing colon cancer, reduces feelings of depression and anxiety, helps control your weight, helps build and or maintain healthy bones, muscles, and joints, and helps with balance so that there is a decreased risk for falling. So overall, all in all, exercise helps promote psychological well-being in a number of fronts. So how do we proceed with the treatment of osteoarthritis? Again, the first and most important aspect is you want to promote a non-pharmacologic management approach. Education about osteoarthritis and the exercise, which should consist of muscle strengthening, walking, Tai Chi for balance. Stationary cycling is a way that you can help to promote and strengthen the quads and lower extremities if possible. Yoga, and if you're not able to do yoga, you might be able to do chair yoga or chair Tai Chi. So these are some adjuncts that are beyond the scope of everything I'm going to talk about today, but I would encourage you to look at how these are implemented, because they are available aspects, particularly for those individuals who might be limited in terms of their ability to walk. Weight management, you can come up with weight goals in conjunction with your physician to make sure that whatever you're doing is safe based on your other underlying comorbidities that you might experience. So let's move on to types of exercise that you can implement. So here are some exercises that you might be able to implement. So in this graphic, you'll see stretching. So in the top graphic, just twisting at the waist. It's called back stretch. Another type of exercise, B, shoulder shrugs. So what you're doing in that setting is you're just essentially sitting in your chair and you're raising the shoulder and you're trying to move the shoulders in a full 360-degree effort. These are called shoulder shrugs. And what does that help with? It helps with the rotator cuff. So those of you who might experience shoulder pain or rotator cuff disease, if you were able to do 10 circular motions, shoulder shrugs backwards, and then you follow that up with 10 forward. And when you're doing these shrugs, you want to do them slow. And as you're bringing your shoulders back together and your scapula together, one of the things you might want to think about is, can you bring your shoulders together to where your scapula, that's the bone right at the back of your shoulders, can you get it to where your scapula are almost touching? Obviously, you won't be able to touch both scapula together, but that's the goal. As you're doing these shoulder shrugs in a full 360, you want to bring your scapula as close together as possible while you're doing it. Okay, another exercise that you can do, neck stretching. So it's depicted right there, and you're just doing motion where you're turning your head in the no position, back and forth, back and forth. And then you're also going to do some neck stretching where you try and take your neck and move your left ear as close to your left shoulder as you can do it. And then move your right ear as close to your right shoulder as you can do it. So all of these are done in sets. So just as I mentioned with the back stretching, you're going to do that set of 10, and then you take a break, and then you try and do it again. The shoulder shrugs, a set of 10 backwards, set of 10 forward, a set of 10 backwards. Same thing for the neck stretching. You do the no motion, and you do 10, and just count slow. We're not looking for speed. We're looking for trying to mobilize the movement as much as possible. Here's another one, arm circles. You remember that from grade school, I'm sure. So you have your arms out to the side, and then you're just making increasingly concentric circles left and right. This is good for your rotator cuff. Okay, so arm circles, again, 10 sets of 10, and do 3 per day, and that would be good for the shoulders. Okay, E, I have the standing groin stretch. So for those of you that are able to do it, you are basically leaning in one direction, and just as the graphic shows, you are stretching out those leg muscles that are trailing. And then you switch, and make sure that while you're trying to do this, that you're stable and that you're not going to fall. But this is another maneuver that is helpful. And this is going to be helpful for the back and for the hips, the standing groin stretch. It also helps to provide some balance and stability. Now, F, the calf stretch. So here what you're doing is you're leaning against a wall, for example, and then you take the trailing leg and you try and press it back and flatten the heel against there. So the knee is not, the trailing leg, the knee is straight, and you're trying to stretch out the calf as much as you can. That's called a calf stretch. Then after you've done 30 seconds to a minute of one, then you try and switch up and do the other leg, where the other leg is trailing. Stabilize yourself against the wall and make sure that when you implement these, you're avoiding a situation where you might fall. Okay, G shows the modified sit-up. So this is just a modified sit-up to help to strengthen the core muscles in the abdomen, and that helps with low back issues. So for those who might experience some low back pain, core abdominal strengthening is key. And this is a way to try and implement that with the G, modified sit-up. For those of you who are able, H, the hamstring stretch. And you see that depicted there. You remember that from grade school, I'm sure. And then I is the sitting groin stretch. Again, this might be difficult for some of you, but you can do modified versions of this to try and stretch those muscles. Okay, J is the side stretch. So this is something that might be implemented after A, the back stretch, just to try and stretch the muscles the best you can. And then K, the quadriceps stretch. Again, you want to be careful, make sure that you're stable when you're doing this type of exercise and avoid falling. Sometimes you might need someone else around you to help with these, but these are all helpful exercises to implement. Let's look at some more. For those who are able, some simple weights like curls with the palms up. 2 to 5 pound weights, that's fine. We're not trying to get you ready for the Olympics. We're just trying to get you in helping with your quality of life. So curls, palms up, and then you can do the reverse curls, palms down. So those are pretty simple to implement, and these can be done from a chair. So for those who are able to do that, you could do it from a chair. Again, you're just looking for a 2 to 5 pound weight to do that type of thing. In C, you see the bent knee over rows. These are rows, and it's just flexing back and forth, back and forth. These are great for the rotator cuff. D, you have the tricep kickbacks, and you can see in the graphic how what you're doing is you're extending the arm backwards, and what you're doing is you're strengthening your triceps. Again, this is a great exercise for the rotator cuff. E, the side lift. This is another excellent exercise for the rotator cuff. You would want to do no more than 2 to 5 pounds at most. And an F, military press, just going straight overhead. Light weights is what I would emphasize in this setting. Step-ups are an excellent way of strengthening the lower musculature, particularly the hamstrings and the quads. And then basically you place your foot on the step up with the right, and then you move the left foot back down, and then step down with the right, and then you repeat this sequence 10 times, and then you change the order of feet. And this is excellent for both your knees and for your hips. It also helps to promote balance and stability. Growing up, one of my favorite early shows was Superman. This is called the Superman maneuver. What does this do? It helps the rotator cuff. So you lie face down on a towel. You can do it on your bed as well. And then you extend your hands in front of the body, and you lift the arms and the upper body away from the floor. And you do a slow count, 5 seconds, rest, and then you repeat it 10 times. So this is the Superman exercise, and it's excellent for rotator cuff preservation. What about osteoarthritis of the hands? Well, simple hand flexion, extension, flexion, extension. You can sometimes do this against some form of resistance, and As described here, you hold both hands with the fingers pointing toward the ceiling. You roll the tips of the fingers down slowly to make a fist. Hold it for 5 seconds, relax, and repeat. Roll the fingers down to make a fist slowly. Hold for 5 seconds, relax, and then repeat. And do again, sets of 10. Strengthening of the hands also can include strengthening of the wrist. Here, you're going to hold your left arm straight out in front of the body with the palm facing down. And then using the right hand, you're going to grasp the left hand and gently bend the hand downward until you feel a stretch in the forearm. And then you're going to hold for 10 seconds, relax, and repeat. Switch hands and then repeat the same exercise with the right hand. This is a form of the calf stretch that I showed you in the earlier graphic. Here, you're pressing against the wall, and you're stretching out that calf, trying and put the, you don't want to bounce, by the way, when you're doing this, but you want to lay your heel completely flat on the floor. That helps to stretch out the calf, and it's a great exercise for stability, for balance, for helping with the ankles and also the knees as well. This is an exercise to help with the hamstrings. So the hamstrings are the muscles in the back of the thigh. So when you want to stretch them, you can get a stable stool and place your hands on your hips, place the right heel on top of the stool, and you're going to bend the left leg and slowly lean forward until you feel a stretch in those hamstrings. Hold it for 10 seconds, rest, and repeat. That's the hamstring stretch. And the importance of trying to target all these muscles, again, is to see if we can help to promote a better balance and avoid falls. And these are the types of things you can do or implement. For those of you who are able, you could lie on a bed or on a towel on the floor. And this is basically knees to chest wall. And then you're going to feel a stretch in the low back and the buttocks. You're going to hold for 5 seconds, rest, and repeat. And you do, again, sets of 10. This is, again, some of those motions that I was telling you about. This is the trying to get your right ear to the right shoulder, left ear to the left shoulder. You can do this sitting or standing. You want to look straight ahead while you're doing that, and hold for a count of 5 and repeat it, the sequence 10 times. This is great for mobility of the neck and also will help promote balance as well. In the same manner, you can also do the rotatory motions where you're going to do the no motion. Your target could be try and bring your chin to your right shoulder, try and bring your chin to your left shoulder, and slow counts, and do sets of 10 again. So for those of you who are not able to do the standing exercises, you could try doing things on a chair. So this is a form of chair yoga, and it does help the low back. It helps the rotator cuff, and it helps your balance, even though, again, you are you're in a sitting position. So doing some modification of this is certainly beneficial, called chair yoga. And for those of you who are interested in exploring this more, you can easily look this up on the internet, chair yoga. hip exercises. Again, I emphasize stability. Make sure that whatever you're doing in all of these exercises, you are positioned in a manner that you don't fall or get dizzy. This is a form of hip exercise, as this gentleman is demonstrating, where he is abducting the hip, and it strengthens the muscles surrounding the hip while he's doing that. And he's stabilized with the chair in front of him. So a lot of this we covered. These are shoulder exercises. Again, this is helpful for the rotator cuff. You can see arm twists, simply the hands facing forward, the hands facing backward, just while the arms are at your sides. And then you can do the same arm twists with the arms raised. So raised at a shoulder level, and hands facing forward, hands facing backwards. And then what we call the half bow. It's almost like, you're being held up, your hands are up, and then you bring them down to shoulder level. Back up, shoulder level, and then back down. Excellent exercises for the rotator cuff. In the back, we're showing you the internal rotation exercises, and that is why in the back diagrams you see that the gentleman has his arm behind his back, and that's helping promote internal rotation of the shoulder. Again, excellent for the rotator cuff. What about Tai Chi? Tai Chi is helpful for balance, might help to prevent falls. So some of the things that you can simply approach are things like standing and trying to be well aligned while you're standing, as shown in the first graphic. When you're sitting, you want to be well aligned while you're sitting. So in this position is considered good alignment. Make sure your back is straight. And then doing things such as shifting weight, and then so-called Tai Chi walk. All of these help to promote balance, help to avoid falls, and are beneficial. So I think I've shown you a lot in terms of exercises. You can pick and choose from these exercises. I believe my presentation will be available to you that you could convert into a handout, and then you can study these exercises more closely and pick and choose what would work for you individually. But the take-home point, which I gave you early on, is that the most important approach to treatment of our underlying arthritis is exercise. But the exercise has to be tailored to your individual personal situation. So I'm happy to open it up to any questions that anyone has, and thank you for your attention.